Amicos, my name is Dr. Rao and we are going to see general pathology. This is the lecture series on general pathology. First chapter we are going to deal in this lecture series is cell injury and adaptation. Here, first topic we are starting is cell response to different kinds of stimulus. But before moving towards what are different kinds of stimulus and how cells react to those stimulus, you should know normal cell. So what do you understand by the normal cell? Normal cells has a specific function, has a specific structure and sometimes a specialized action. Okay, so these normal cells has fairly narrow range of function and its structure is dedicated to its metabolism it is performing. What kind of function it is performing, that specific kind of function requires specific kind of structure and that structure is depicted by that cell. Now let us move towards the specialization or special characteristics of cells. Like in heart there is cardiac muscle, but some group of cardiac muscle are self-excitatory, right? Atrial node, yes. So those are the specialized action, right? So the specialized action is imposed by the neighboring cells. What is the requirement of that organ? What is the requirement of the neighboring cells? On the basis of that they do their specialized action and by the availability of the metabolic substrate, right? But you should know that your body is in the constant state of equilibrium. There is a steady maintenance of a steady state of health in the body and that is called as homeostasis, right? Now this homeostasis is broken down or is broken because of the stimulus, the external stimulus what body is receiving. To that stimulus body reacts and hence there is breakage of homeostasis. Okay, so what are the different kinds of stimulus we are going to deal in this first chapter and how the cell react to those stimulus. So first of all we have this cell, right? Here we are getting an external stimulus. Now on the basis of how long and short term the stimulus is, obviously we are going to divide this stimulus into short term stimulus and long term stimulus. So what are those? Short term and long term. Okay, so first of all we are going to deal about the short term stimulus. Now this short term stimulus, on the basis of intensity of the stimulus, we are going to further divide into non-lethal, lethal and sublethal but persistent. Okay, so we have non-lethal, then we have lethal and then we have sublethal. Okay, so whenever a body or a cell gets sublethal stimulus, it goes into adaptation. Body within fastly adopt to those stimulus and that is called as cell adaptation. Okay, so what are different kind of cell adaptation? First we have hypertrophy, then we have hypoplasia, then we have metaplasia and then we have atrophy, right? Now if the stimulus is lethal, what is going to happen? The cell will be injured. There is injury of the cell. So if the stimulus is lethal, we have cell injury. Okay. Now this cell injury can be reversible cell injury or can be irreversible cell injury. So we are going to divide it into further reversible and irreversible. So reversible and then we have irreversible. So what are the different kind of irreversible cell injuries we know? First one we are going to study about is necrosis. Then we have apoptosis. Then we have necroptosis. Then we have pyroptosis. Okay, so these are different kinds of irreversible cell injury occurring in our body. And then we have sublethal but persistent. मतलब वो short term से थोड़ा ज़्यादा, means a little bit more than the short term, but it does not enter into long term type of stimulus. So sublethal but persistent. I'm going to write it in blue, but persistent. What is going to happen here is that there will be intracellular accumulation of substances. Okay, so different kinds of substances and pigments is going to accumulate inside the cell. What is it? Intracellular accumulation. So it can be lipids, right? It can be protein, right? It can be pigments. It can be foreign body. Excuse me with the spelling. And it can be calcium. That we call it as, yes, we call it as calcification, right? If the stimulus is for long term, there is long term mild stimulus, that will lead to aging. Okay, so all these are different kinds of stimulus and how our body reacts, whether there is injury, there is accumulation, there is adaptation, whatever it is. So all this we are going to learn in the first chapter, cell injury and adaptation. Thank you so much.